the Jarwa, the Paleolithic tribe of an indigenous people living in India's Andaman and Nicobar Island, and an attempt to mainstream the Jarwa tribe in 1970 ended up badly. It has a devastating effect on these tribal people. It strips them of their self-sufficiency and sense of identity and leaves them struggling at the very margins of the society. Rates of disease, depression, addiction, and suicide within the tribal community almost inevitably so. This is very good example of what primordial prevention is. People of Jarwa tribe were living the life of hunters and gatherers, mostly surviving on the fruits, wild roots, tubers, and honey. And most of the time they have to travel a long distance to collect it. We try to show them our modern world and our lifestyle. We offer them packaged foods, but few were not able to digest them, and many have become obese because of it. They were introduced to tobacco and alcohol, and they instantly became addicted to it. They are gradually losing their primitive way of life and culture and becoming prone to the diseases and the risk factor of the modern world. Primordial prevention is a term used in public health and refers to the prevention of the emergence or development of the risk factors in a countries or population in which they have not yet appeared. Friends, in today's video we are going to talk about various levels of disease prevention. There are 4 basic levels of disease prevention which can prevent or modify the occurrence of disease in the community. First is primordial prevention, second is primary prevention, third is secondary level of prevention, and final and fourth is tertiary level of prevention. Primordial prevention. This type of prevention focuses on reducing the risk of disease by addressing the root causes and modifiable risk factors, such as preserving the traditional way of living, promoting healthy lifestyle, improving access to healthy food and water, reducing exposure to environmental toxins, and promoting policies that support health and well-being. The goal of primordial prevention is to create healthy environments. By addressing the underlying cause of disease, primordial prevention can reduce the burden of disease, improve health outcome, and promote healthy aging. To understand the level of prevention, we have to understand the natural history of the disease. How does the disease occur in individual or in the community? Which are the causative agents, risk factors which are responsible for the development of any disease? That we have to understand first. It is divided into pre-pathogenesis and pathogenesis period, before man is involved and after man is involved respectively. And the primordial prevention starts before the pre-pathogenesis. That is why primordial prevention looks very intangible or less intuitive, because there is no disease and no risk factor are present. Now let us talk about primary prevention. It can be defined as action taken before the onset of disease, which removes the possibility that the disease will ever occur. How we can achieve primary prevention, or which are the measures we design? Let us take 2 examples. One from the infectious disease and another one from the non-communicable disease like coronary artery disease, hypertension, or diabetes, and try to understand what is primary prevention is. In the case of infectious diseases like measles, we can prevent measles if we can prevent the interaction of the measles virus, host, and the environment. How we can do that? By health promotion or specific protection. Example of health promotion are health education. First, educating and encouraging people to timely take necessary precautions to prevent measles, for example avoiding crowded places and frequent hand washing. Health education is one of the most cost-effective interventions. Environmental modification. Provision of safe water, installation of sanitary latrines, control of insects and rodents, improvement of housing, etc. Nutritional intervention. Examples of nutritional interventions are food fortification, nutrition education, midday meal scheme, etc. Lifestyle and behavior modification. Let us take the example of diabetes and discuss what is lifestyle and behavior modification as a primary prevention. World Health Organization has recommended two approaches. One is population mass strategy and the other one is high risk strategy. In population strategy at a mass level, we encourage people to adopt healthy lifestyles which include maintain a healthy weight, eat a healthy diet, a diet that is high in fiber, whole grains, fruit, vegetables, lean proteins and healthy fats can help in preventing diabetes. Avoiding processed and sugary foods and drinks can also reduce the risk of diabetes. Exercise regularly. Regular physical activity can help prevent diabetes by improving insulin sensitivity and glucose metabolism. Aim for at least 150 minutes of moderate intensity exercise per week such as brisk walking, cycling or swimming. Manage stress. Chronic stress can contribute to the development of diabetes. Practice stress reducing activities such as mindfulness meditation, yoga or deep breathing exercises. Quit smoking. Smoking increases the risk of developing diabetes. Quitting smoking can help in preventing diabetes as well as the other chronic conditions such as heart disease and lung cancer. Monitor blood sugar levels. If you have a family history of diabetes or other risk factors such as obesity or sedentary lifestyle, monitoring your blood sugar levels can help you catch any abnormality at an early stage and take action to prevent the development of diabetes. While in high-risk strategy, above measures are applied among the people who are at risk of diabetes. For example, having a family history of diabetes, sedentary lifestyle, obesity, etc. Friends, it is worthwhile to note that many industrialized countries like UK, France, Japan, and many others were successful in eliminating infectious diseases like cholera, typhoid, dysentery, and able to control the several others like plague, leprosy, and tuberculosis. Not merely by medical interventions, but also by raising their standards of living. That is primary prevention. Another useful mode of intervention in primary prevention is specific protection. How we can protect the host so that the disease agent cannot infect him? Well, it is possible through immunization, by taking vaccines against various diseases and using specific nutrients like iodized salt to prevent goiter are the examples. Chemoprophylaxis, for example chloroquine or doxycycline to prevent malaria, use of a helmet to prevent severe brain injury, and so on. To summarize, primary prevention is a holistic approach. Activities and health measures such as sanitation, infection control, immunization, food, milk and water safety, environmental protection and occupational health are all basic primary prevention measures. The most interesting thing about primary prevention is that it is available at low cost and they are safe to use. Now let us talk about secondary prevention. Secondary prevention is a level of preventive medicine that focuses on early diagnosis and treatment to prevent the progression of a disease or complications. This level of prevention is often used for individuals who have already been diagnosed with a disease or condition or who are at high risk of developing a disease. The goal of secondary prevention is to identify the disease or condition early when it is still treatable and to prevent or delay its progression. For example, secondary prevention for cancer may involve regular screening tests such as mammograms or colonoscopy to detect cancer early when it is more treatable. Similarly, individuals who have been diagnosed with diabetes may receive regular blood sugar monitoring and education on self-management to prevent or delay the onset of complications associated with the disease. The health programs initiated by the governments are usually at the level of secondary prevention. Few advantages of secondary prevention are early detection, preventing complication, reduced mortality and cost effectiveness. And some disadvantages are it is ineffective in preventing the transmission of diseases, more expensive, and false positives can lead to unnecessary anxiety further testing, and sometimes even unnecessary treatment. The set of interventions and actions aimed at managing and treating the consequences of a disease or condition that has already progressed to an advanced stage or caused significant disability or impairment is called tertiary prevention. The goal of tertiary prevention is to prevent further progression of the disease, manage its symptoms, and improve the patient's quality of life. Examples of tertiary level of prevention interventions include rehabilitation and physical therapy. These interventions can help patients with physical impairments or disability regain function, improve mobility, and manage chronic pain. Medication management. Medications can help manage symptoms of the disease, prevent complications, and slow down the progression of the disease. Surgery. Reconstructive surgery in leprosy or elephantiasis to improve mobility. Psychological support. Patients with chronic diseases or disability may experience emotional distress, anxiety, or depression. Psychological support can help patients cope with their illness and improve their quality of life. Support groups. Support groups can provide patients with sense of community and peer support, as well as valuable information and coping strategies. Examples of rehabilitation are establishing schools for the blind, provision of aids for the crippled, reconstructive surgery in leprosy, muscles re-education and graded exercises in neurological disorders, change of profession for a more suitable one, and modification of life in general in the case of tuberculosis, cardiac patient, and other. The purpose of rehabilitation is to make productive people out of non-productive people. The advantages of tertiary level of prevention include improved quality of life. Tertiary prevention can help patients manage the symptoms of their disease, maintain independence, and improve the quality of life. Prevention of complications. Tertiary prevention can help prevent complications associated with advanced or untreated disease, such as infections, pressure ulcers, or cardiovascular events. Cost effectiveness. Treating and managing chronic diseases through tertiary prevention can be less costly than treating complications associated with advanced or untreated disease. The disadvantage of tertiary level of prevention include limited effectiveness. Tertiary prevention may not be effective in treating or managing certain diseases or conditions, particularly those that are very advanced or untreatable. Side effects. Tertiary prevention interventions such as medications and surgery can have side effects which can be harmful to the patients. Cost. Tertiary prevention interventions can be expensive, which may limit access for some patients. So this is all about various levels of disease prevention. Thanks for watching. If you are first time here, don't forget to leave us like and subscribe the channel. See you in the next video really very soon.